Hi, I'm going to show you how to put on the CircAid wraps for lower extremity edema in patients. It can only be an RN or an LPN that dons these garments. A CNA can take them off for a bath or a shower, but it always has to be a RN or LPN that puts them back on. First of all, there's three pieces to this system. The type that we use here are called a CircAid, and generally you're going to have this identical wrap for any patient that you see. The first piece that goes on is just a compression stocking that goes from toe to ankle. So similar to putting on a regular compression stocking, I always put the sock on my hand, pull it back halfway, make sure you remember where the heel is. And then you're going to first put it over the toe, and then pull the rest over the top. Making sure again that the heel seam is directly over the heel, and the stocking is pulled up as far as is comfortable, and we have extra toe room as well. Second step for the CircAid is just a heavy stockinette that comes with this system. Each resident should have a spare stockinette and sock for each leg as well, so they can get washed out every day. For the stockinette, there is a seam on the bottom, and that's always going to go towards the ankle or the foot. And when you pull this on, it may go over the knee a little bit. That's okay, because we're going to fold it back down at the end. So for the actual Velcro wrap itself, the brown is the outside, the black is the inside, and it does tell you that this is the top, so that you know when you're putting it on that this is what's going to go towards the knee. So you're going to lay this under the patient's leg, and I always anchor the top Velcro just so it doesn't move around very much while I'm starting at the bottom, because you always want to start with your pressure at the bottom and work your way up so you're pushing the fluid the correct direction. So you're going to want to take the bottom two Velcro and just pull across snugly. Then you're going to want to pull the third one over across and make sure it's snug. And then the last two, cross and snug. So with these, technically you just have to pull them till, like I said, it's a snug fit, but it does come also with a gauge that you can measure from black line and make sure that we're somewhere on the black or the pink between 30 or 40 millimeters of mercury, and that shows us that we're getting enough compression to keep the edema down. So after you have everything Velcroed up, you'll just want to cuff this over the bottom and cuff this over the top so everything stays in place, and then the patient can wear a regular shoe or they can wear a grip sock over the top of these two. So the wearing schedule with these are kind of the same as compression stockings. It's going to depend on the patient and if they need to wear them 24 hours or if they can come off at night. Again, check the ADL for those. There should be an order written to identifying specifically what the wearing schedule is. If there's any redness or irritation, you're going to want to immediately take off the wrap, notify therapy, and we'll do an assessment to see what's causing it. Sometimes it's just that we're putting it too snug or it's not in the right position. Again, they're going to have an extra stockinette and an extra compression stocking with each leg, so they can be washed out at night, and then they'll have a fresh pair in the morning, or they'll have a fresh pair right away if they are wearing them 24 hours. But if they're wearing them 24 hours, they should always be taken off once a day to check skin integrity, wash, and lotion as well. Again, if they're painful, take them off for an hour, see how the patient feels. If they're still painful, then take them off and let therapy know.